From Kantai, Avicii, lead singer for award-winning rock band group Chester Bennington, actor Robin Williams, whom many described as one of the happiest people on earth, all had struggles with their mental health. A few months ago, Japanese tennis player Naomi Osaka was at the center of criticism and discussion after withdrawing from the French Open, with US gymnastics champion Simone Biles recently pulling out of both the team final and women's individual all-round at the Olympic Tokyo Games to focus on her mental health. Back home, there has been an increased rate of cases associated with mental health disorders such as suicide, gender-based violence, and murders being reported each day. Which begs the question, what is the state of mental health in the country?
The current state of mental health in Kenya can be defined in two fronts. So one is the private sector and then the public sector. So the private sector is doing really well. Like last week, we just opened a 120-bed capacity level 5 hostel in Lavington for mental health. It's called the Chiromo Group Hostel. It's fantastic. Then we have Oasis and we have many more that are doing really, really well, When it comes to public mental health, which really is the heartbeat of it, a 2011 Kenya National Commission on Human Rights report calls it, like it's really in a dark state. So whether it's in terms of psychiatrists, personnel, to medication, to just the sheer treatment of mental health in public health hospitals is not as we should want it to be.
I think a lot needs to be done. A lot needs to be done in terms of awareness. A lot needs to be done in terms of what we can do to mitigate, because I think we are trying, but we are not yet there.
Experts say that 1 in every 4 Kenyans is suffering from a mental health disorder, with cases related to mental health increasing each day. However, there has been an increased awareness, but affordability of treatment continues to be an underlying factor.
I know many places where they charge, from 3,000 shillings to actually 8,000 shillings per session. That's now private. And honestly speaking, for Kenyans, it looks way high.
The mental health insurance in this country, both private and public health insurance, have not really embraced the mental health package within their insurance covers. So there are few members of the private sector players who are doing excellent work in terms of putting together packages for mental health, but generally it's not. Like, for example, there's a leading medical insurance provider in this country that has in its policy exclusive term that they do not cover neurodevelopmental disorders. That's ADHD, dyslexia, and all this sort of stuff. But they cover depression. So we need to change that.
According to a research by the Lancet Global Health, on average, mental health expenditure accounted for less than 2% of government budgets for health. When asked how many people pay for services, 17% of 168 responding member states said that service users paid out of pocket. Indeed, out-of-pocket payments for mental health services account for 43% of mental health expenditure in the African region and 40% in the Southeast Asia region. While a combination of bilateral, multilateral, private and philanthropic donations have contributed somewhat to filling the gap, development assistance for mental health has never been more than 1% of global development assistance for health.
We are hoping that the 5% mental health budget within the health budget can be increased, but not just increased, then we reduce the recurrent expenditure and improve more to do direct intervention.
Now, when it comes to covers, many public hospitals use NHIF. Is it possible to have that NHIF cover take care of the mental or the mental cases that are coming with people who are coming to hospitals?
According to the World Population Review, the prevalence rate for depression is 4.40%, with over 1 million cases out of the 54 million plus people. However, the ratio of psychiatrist to patient is wide, as there are not enough psychiatrists yet to cater for patients, especially in the public health facilities.
Very few psychologists in public hospitals. For example, if the government says, in every hospital, there will be at least 3 psychologists or 3 clinical psychologists who can come and offer their services.
According to the Lancet Global Health, lost productivity as a result of the 2 most common mental disorders, anxiety and depression, cost the global economy $1 trillion each year. In total, poor mental health was estimated to cost the world economy approximately 2.5 trillion USD per year in poor health and reduced productivity in 2010, a cost projected to rise to 6 trillion USD by 2030.
The mental health burden usually affects the most productive demographic of our society, 18 to 25. That's why now we have all these issues coming, So can you imagine a scenario where people who are supposed to be innovating for us and changing the landscape of our country are battling with depression, anxiety, mood disorders, and they're battling with all these things and they cannot seek help? The Gender Equality Commission did a research in 2016 that found that we lose at least 1.3% of our GDP, about 68 billion shillings, to sexual gender-based violence in terms of litigation costs, amount of money in hospitals.
Kenya recently launched the Kenya Mental Health Policy to give guidance on how to deal with mental health in the country. According to the policy, mental health services are widely underfunded, especially in developing countries. Kenya is among the 28% of WHO member states countries that do not have a separate budget for mental health.
And then now we need to go to other departments, labor, devolved units, so that ultimately, cumulatively, we are addressing mental health. Even the Ministry of Education needs to have a mental health budget in terms of schools and teachers. Let's go to the prisons. Can they have a mental health budget for the prison officers and for the prisoners? Let's go to the police force. You know very well what's happening within the police force, so that the solution to mental health is mainstreaming mental health in every part of our society.
For now, organizations continue to raise voices on the need for increased investment on affordable and accessible mental health care.
No one wakes up one day and says, I have depression. No one wakes up and says, hey, I found myself with ADHD. These are things that we sometimes carry because of how our genes. Sometimes it's because of the environment we grew up in. Sometimes it's because of, for example, you go through an accident, you had PTSD. You did not ask for it. Having a mental problem does not mean that you are mad. It means that you need to be okay. The same way you go to hospital and get medication, it's the same way when you are feeling like you're not okay mentally, you should go and seek help.